I needed dental work following trauma in July of 2009. I had an accident when I was letting my horse go out the paddock, copped a kick to the side of my face, the left side of my face, just around my cheek here. So my jaw was broken in 3 places and about 12 teeth damaged at the time. It was a pretty hectic time. I was in year 12. Spent about 3 or 4 days in the Royal Adelaide where I had the jaw side of things fixed up, and following that, I guess you just want life to get back to normal, and all of a sudden your teeth are all broken, you're on a liquid diet. I don't know, I wasn't very confident about myself anymore. I'd lost a lot of weight. It was quite a stressful time. Before I had the prosthodontic work done, I had endodontic work, root canal on 8 teeth, all in one day, and I did that twice. Also spent a lot of time with the oral maxillary surgeon who actually rewired back my gum, which was flat at the time of the accident. So I only could attend prosthodontic work maybe a month or so post my accident, just because they had to fix the underlying gum issues before I could look at my teeth. I learnt about Lidums from the oral maxillary surgeon at the Royal Adelaide Hospital. The first consult we just fixed up a little touch-up job on my 2 front teeth, which then I was confident enough to go back to school, but we still had to do a lot of implant prep and just fix up the underlying things, looking at my braces before and the teeth molds for that to work out how we'd go about deciding, do we want crowns or implants, or what sort of options were available for the different damage that was done. Well, it was something I'd never really had to think about before, and it was a real shock. I didn't really understand a lot of the processes and didn't understand how complex and involved it was to have my teeth fixed up, and I guess that was disappointing for me at my first visit. But I guess at the time I was 17 and my parents had a pretty big influence in the dental work done, and we just made a conscious decision that we wanted as much done as possible. Okay, I had a few different procedures to my front teeth, and the ones where there was still some tooth there, we had crowns added to the front, and they're made from porcelain, and then 1 implant down the bottom. So I had the implant put in and left, and for about 2 weeks, I think, before they could then go and screw the implant in. It might have even been longer than that. It was about 3 years ago now. Such a relief, I guess, is the best word, to be back to sort of my pre-accident state again, and to be able to go to my year 12 graduation and, you know, pop on a nice dress and be able to smile for the pictures, because I miss school photos because I just wouldn't have my photo taken back in August. I guess it's restored the fact that I can eat the foods that I want to eat. Obviously, that's helped regain it to an ideal kind of weight, and just getting life back to how it was before was obviously a big thing. I guess immediately post the accident, there was always the concerns of, I just remember when I'd got inside and there was blood everywhere, and I looked in the mirror and I just remember thinking, I'm never going to be the same again, you know, what's going to happen from here? And it's really overwhelming. You know, you're a young girl and all you care about is how you look, and then all of a sudden it's completely different to how you look. And I remember laying in the ambulance on the way to hospital, and I just said to the amber, I was like, you know, I used to complain about how I look, but thinking back, I was a pretty girl. And you look through the before and after pictures while you sit in the waiting room here, and you're like, oh, I hope I can get a result similar to that. I just hope that in some way people might not be able to realise that I've had this big trauma. And yeah, there was times when I doubted that it would ever be quite like it was before, or how was it going to go? What was I going to have to do to get back there? And I mean, the process now did take probably up to 6 months for me, but that's been 6 months and I'm 3.5 years on, and it's just 6 monthly checkups, and it's all easy sailing. I eat the foods I like. I'm back to how it was before. So yeah, I did get back to where I wanted to be, and some people might say better, I don't know.